Republican Senator Orrin Hatch of Utah. Senator Hatch, good to see you on the program again.
Always nice to be with you, Tony.
Well, let's cut through let's cut through it, all right?
Okay.
This committee isn't going to pass out a bill with a public option. Isn't that the simple, straightforward truth of the matter? No public option in the Finance Committee bill.
Not really. Watch them try and do that co-op approach. It'll be basically the same thing. They'll say that it'll be independent, that it'll be a nonprofit and so forth, but it'll be along the same lines. But the public option that Senator Rockefeller has brought up this morning, I actually believe there aren't the votes on the committee to do that, and thank goodness for that.
Okay, so is your real concern, I've been trying to listen very closely to you,
Okay.
Is your real concern that when the finance bill, which is not likely to include the kind of public option that the Democrats are proposing, is merged with the health bill, which includes the public option, that at that point, the bill will be unsupportable by you? It will be a bill that, in your words here last week, will be the most god-awful thing you've ever seen.
Well, I think that's a fair appraisal of it. The fact of the matter is that the Health Committee bill, I'm on that committee. It was a totally partisan bill, and almost every vote was 13 to 10, party line vote. And frankly, the three bills in the House are all party line Democrat bills. There's very little likelihood that if we do anything good in the Finance Committee, that it's going to last through the modifications that are going to be brought by the melding with the Health Committee, and then ultimately with the three committee bills that will have to be put into one over in the House.
Well, wait a minute. Senator, are you saying to me that you still believe that Senate Democrats will find a way to work the public option into the final Senate bill?
Well, I think they're going to try and do that, and certainly because the House leadership certainly wants it. But I think they also have to realize there are a lot of Democrats who aren't for that. We're terribly afraid of it, because if you go to a public option, that means that we're going to really turn over our whole health care system to Washington, D.C.
Yeah.
And most people out there just don't want that to happen. They know that if you turn it over to the bureaucrats here in Washington, D.C., that this place is going to determine everything that happens in health care, and that means you'll have bureaucrats placed between you and your doctor, your hospital, and so forth. I mean, just look at Medicare and Medicaid. Medicare now pays doctors 20% less, hospitals 30% less. They were supposed to be, on an equal basis,
right,
with the private sector. Well, they're not. Medicaid itself pays doctors 35% less and hospitals 40% less.
But isn't that really a state function? I mean, come on. The states really set those prices, and the states, what you're suggesting here is should do a better job, and then the government plays its role, which is to match, correct?
What I'm suggesting is that these folks on the Democrat side are using Medicare and Medicaid as a piggy bank. They're going to take $500 billion out of Medicare in order to try and pay for this thing.
Right.
And Medicare is already $38 trillion in unfunded liability, and Medicaid's going to go broke in the next few years. So, they just don't seem to realize that the people out there aren't for having Washington, D.C. run all of our lives in health care.
Right.
And that's what they're trying to do. And if they get away with it, we're going to be paying through the nose the rest of our lives, and we'll go straight to what is called a single-payer system. And what they're doing is they're trying to do this in increments. If they can't do it directly, they'll do it in increments until they finally get us to the point where you're going to have socialized medicine. And if that happens, the greatest country in the world with what I consider to be the greatest healthcare system in the world is going to be deeply, deeply harmed.
All right, and let's leave it there. Senator, we're going to let you get back to your work. We appreciate your time, and come see us again.
I will. Nice to talk to you.
Good to talk to you, Senator Orrin Hatch of Utah.